and I will start as well recording on Zoom as soon as I finish the presentation, my presentation as well. So just a brief remember about who we are, the Global Plant Council. As many of you already know, we are a global coalition of plant science organizations that we are working towards raising awareness about the importance of plant science for society. We are also building a community, a safe community, and a sense of community for plant science in order to be able to become a voice of reference for said community around the world, especially on policy, on important policy arenas, and defending the interest of plant science, the plant scientists at a global level. So remember that after and probably also during the conversation of Ross and Julie, we will have a Q&A. There is a Q&A feature in Zoom. I'm sure that at this point of time, most of you already are acquainted with this feature, but it's in the toolbar. Normally that it's under your Zoom screen, there is a toolbar that it's called, depending on your language, questions and answers, preguntas y respuestas. It could different for each of you. You will be able to see all the questions being asked and also vote for your favorites in case that someone already has posed the question that you are most interested in. So thank you, and remember that you can connect with the Global Plant Council in various ways, of course, on social media, and also by writing me personally an email to my address, isabel@globalplantcouncil.org, and always by visiting our website. So Ross, I will leave the floor to you now.
Good. Well, thank you very much for that introduction, Isabel. And I did get to know Isabel with the Global Plant Council when I was president of it for a number of years. And we thank the Global Plant Council. We thank the Global Plant Council for hosting this webinar on their platform because it's, cross-disciplinary. It's not just plants, but it's more than that. I also just want to thank Kira Ma, who's also one of the panelists. Kira has been involved in a lot of the logistics and is doing the administrative support for the working group for Safe Cassava. And before I introduce our guest, Julie Cliff, I thought I would just say something about why am I doing this, because I'm a plant scientist and I don't study Konzo, and I haven't studied Konzo, so why am I doing this? I do research on plants that make cyanogenic glucosides that break down to release cyanide, such compounds that are in cassava. And originally I was working on eucalypts, and I kept reading these papers about this plant called cassava. I'm from Australia, from Monash University in Melbourne, Australia. We don't really eat very much cassava here. And I kept reading these papers, and I kept coming across this particular people such as Julie Cliff, who was writing papers on this. And so I became very interested and then I was connected through another Australian called Howard Bradbury. And he said, if you're interested in cassava, you should go to Mozambique and meet Julie Cliff, which is what I did. And that's why we're at where we are today. Julie is a physician and epidemiologist and has been instrumental in setting up community health and public health programs in Mozambique particularly. And she's written some very important papers and books and has very many honours. In Australia, she has what we call an AO, which is, if you're familiar with the English system, it's the equivalent of the OBE. The Officer of the Order of Australia. And I looked that up, and it's for her leadership in international health and in setting up community health in Mozambique. So Julie, welcome, and I look forward to hearing what you've got to contribute today.
Thank you.
To start with, I thought you're known for the work you've done on Konzo and the early discoveries and your ongoing work. So could you just tell us what Konzo is?
Konzo is a paralysis, although the neurologists don't like us using the word paralysis. They prefer to say paraparesis. So it's a paralysis. It's predominantly in the lower limbs, which makes it difficult for people to walk. And in the more severe cases, the arms are usually involved, but they're not so affected with paralysis. And you get some symptoms in the eyes as well. But the main thing is this difficulty in walking because of the weakness in the lower limbs. Comes on suddenly, very dramatic, and it's there for life. It doesn't get better. So it's a frightening disease for those of us who have seen it. Healthy people suddenly unable to walk. So that's what Konzo is. It's spastic. So it's harder to move the limbs, yeah.
So when you say it comes on suddenly, do you say, would it be like from one day to the next or from 1 week to the next?
More like one day to the next or a few days. And the people go to sleep and they wake up and they can't walk properly. And it can go on for a few days, but it's usually quite sudden, which is unusual to have something coming on so suddenly and so drastically.
So when did you first become aware of this disease?
I became aware of this disease back in 1981. It's a lot of years now. I was working in the Ministry of Health in the epidemiology department, and we got a telex saying that there were cases of paralysis in one of the districts in the north of Mozambique. There were over 30 cases, and that they were spastic cases. So people thought, oh, because this is polio, but it's not, because polio, you get weaker, whereas this is a spastic paralysis, where it's hard to move. The limbs feel spastic, they really do. So I went to investigate this epidemic in the north of Mozambique, and we had over 1,000 cases of people paralyzed in not such a big area. So I went to investigate it. I went with other people, a microbiologist, a neurologist. We got there, we found the team there was absolutely special because, as well as some very good Mozambicans, in the district hospital was Dr. Hans Rosling, who later became one of the most famous epidemiologists in the world. And he was there on the spot with another colleague, Anders Molin, and they had already begun to do the investigations into the disease. So for me, this was a sudden call to an epidemiologist.
I've got a couple of pictures that you gave me of that. I've got a couple of pictures that you gave me about this, so I'll just do it. That was the disease. So there's that picture. That's you back in about 1981 or whatever. And this is Hans Rosling. And what's he doing here?
He's looking for clonus of the ankle, because when you have bad spastic paralysis, your ankle won't, if you push it like that, it starts contracting and it won't stop. And it's called ankle clonus, and it's characteristic of Konzo. So Hans Rosling was looking for that.
And
this was in the early days.
Yeah, so this is quite different than if it was polio. You wouldn't see this, it'd be something else.
Oh, absolutely different, completely different. But people still confuse it. People are looking for polio, and then they've got cases of paralysis. So the confusion is still happens. Yeah.
So I think I've got a picture here. This is a copy of that telex in Portuguese saying, come and have a look. I'm sure some of our audience speak Portuguese, so that's not a problem. And this is the map that you gave me, which was from, I think, the original publication. So this is Mozambique, Tanzania, Malawi, Zimbabwe in Africa, and here's the area of Mozambique where he was working. And this is this the whole area that was particularly common with Konzo?
Yes, it is, although that was in fact a fairly early map. Konzo extended further than that, especially to the north. But it's a map that shows that this was over a wide area. This was not a small area. It was large and therefore hard to investigate.
So here's one of the pictures from the time. I think you took this picture. Do you want to tell us anything about this?
Yeah, this is a mission in Member, which is one of the worst affected districts. And at that mission were some very devoted Italian sisters of the Comboniani order. And they had set up a rehab center for people with Konzo. And this is just a group of the children. And you can see for us how shocking it was. These were formerly healthy children, now walking with, or not walking, with great difficulty. And this was taken in that particular mission.
So from having seen this disease and you realised it was something different, how did you work out the connection to cyanide or cassava or anything? How did that happen?
We didn't originally, because we were doctors and infectious disease people. And I still remember an old man in one of our early meetings saying, this is the cassava. And we took notice, but we didn't take the notice that we should have of his observations. So we sent samples off with the help of WHO, and they looked for all the common diseases that cause paralysis, the viruses, and they didn't find anything. So then we remembered those words of the old man and the fact that there was a lot of dried out cassava being eaten. And so we wrote and asked for them to test for cyanide. So they tested for thiocyanate, and the values were just sky high, bigger than had been seen anywhere. And I still remember the day when we came back. We were out working in the district, and we came back. And before we could even get out of the car, Hans Rosling had rushed up to us and said, this is cyanide poisoning, because he'd got the results back. And this was days before mobile phones. You know, we were not in communication properly when we were out in the district. So it was the suggestion of people in the area, but confirmed quite quickly when we got the results back. So
if it was
that. So if
it was cyanide poisoning, then you had to make that connection then to cassava. So you knew that cassava had cyanide in it.
Connection. We did not have a good connection, but we knew that there'd been cases reported of paralysis, but we hadn't seen anything of an epidemic this large. So I actually went, and this is the days before we had computers, and I sat in the library at the University of Zimbabwe and went through all the old literature. And in that old literature, we found that these epidemics of what's now called Konzo had happened before in the Democratic or the DRC, the Congo. So that's how we found out. We looked through the old literature and we had these sky-high values of cyanide. But now I'm going to complicate you a bit, because we had control specimens as well, and they also had very high values of thiocyanate. So ordinary people had cyanide poisoning as well, but they didn't all have the signs of the paralysis. Sorry, has that been a bit confusing?
No, but is that because you think they just had low
it.
level? They just had low levels, did they?
No, we've never worked it out. And
Right.
because we didn't find such big differences, and they also didn't find so much in the Congo. So it's one of the criticisms people make, that you haven't found controls with low levels. It's a criticism that one can make. But in every epidemic of this disease, we have had people with high thiocyanate values.
Right. So here's another slide that I think is where you've actually, this probably to some extent from your research, or might have been more recent. This is the date of the first recording of Konzo in all these different places.
Yes,
we don't need to stay
once we had described it, and this was in 1981. You know, Konzo has been popping up across Africa. And you can see some of those are quite recent, like Angola was 2010, Zambia was 2013. So, you know, there's a lot of, it's continued basically. And so it's across the broad stretch of Africa.
So why do you think there was an epidemic there've been obviously subsequent epidemics in Mozambique, but why do you think there was this big epidemic in 1981?
Because there was a terrible drought then. So people were living on a very monotonous diet of cassava. And in droughts, as you've shown, the cyanide level in cassava goes up, or the cyanogenic glycoside level in cassava goes up. So our first epidemic was drought. Our second big epidemic was war. And so it's when you get unusual agricultural situations that this happens. And there are parts of Africa where it's happening anyway, because the situation is bad. But usually it's when there are agricultural crises.
Right, and certainly from the work that I've done, we know that the plant itself actually makes more cyanide under conditions of drought. So I've got somewhere, I've got a picture of this. Let me just check it. I've got a couple of pictures. Here we go. Yeah, just so for people who may not know, this is cassava, what it looks like. And here's, you know, this is why people grow it, right? It's just incredibly productive. You know, even in unproductive areas, you get about eight tons a hectare, which is incredible for amount of food. So people are going to eat it. But this was from, I think, from that 1981 drought where all the plants were dead, or they died right back. And so the plants themselves were probably high, plus there wasn't anything else to eat.
This was during that drought in 1981. Yeah.
Right. Okay. Yeah. Okay. That's good. I mean, that's not good, but I'm pleased to clarify that. So for those who don't know, they're the stems there of the plant. So you did some surveys, and I think these are two different surveys. I'll put them on the one slide, so you'll probably get cross with me about that. But do you want to just explain what's going on in this left-hand one? The caption is in Portuguese, but I think from looking at the names, quite a few people in the audience will be able to read that.
Yeah, well, what we can see there is that it's a classic epidemic curve. And so the cases of paralysis happened, and then they didn't get better, but they disappeared. And we've found that in general in Mozambique. And this epidemic happened during the dry season. And during the dry season, there's no other food to eat, but also we know that the cyanogenic glucoside levels in cassava go right up. So there's two reasons. So this tends to be a seasonal disease. It happens at the time of the cassava harvest when people are eating a lot of cassava, and it's worse when there are droughts. And this is the slide that's going to confuse everybody, because we see here the patients in this study, the value was 329 micromoles per litre. But then when we did a case control study, the controls also had high levels of thiocyanate. So, that puts a doubt on the whole question. And then we can see below the normal values for pregnant Mozambicans. So you get an idea there of the thiocyanate concentration. And that was that year of 1981.
All right. Just to explain to people what the thiocyanate is and why it's in the urine.
Basically, when cyanide's metabolized, it's metabolized by turning itself into thiocyanate, which uses sulfur. And you can find high levels in the serum. And we also switched to measuring urine because people don't like having blood taken. So this was at the time of the epidemic when it was an emergency, so we could do it. But in fact, we later used urinary thiocyanate as our main measurement.
And you also said you had neurologists and microbiologists and things with you on your investigation team. So you must have had a lot of different people on that investigation team.
Yeah, we had a fantastic team, and there was one Dutch botanist, and he classified all the plants for us. He helped us collect the specimens. And that was the big advantage of our team. It was a mix of people. So we had the plant specialist as well as the human specialist, and that was an enormous help.
So you wrote this up, I think, in Portuguese originally. Was that for the Ministry for Health?
Yeah, well, our first reports were in Portuguese, and we did a special edition of the Mozambican Medical Journal, but we also wrote it up in English and submitted it to WHO. So what we had found got publicized quite quickly. So we were able to draw attention to it. And I think we were very lucky as well because the people working on it. I mean, in Hans Rosling, we had one of the best science communicators ever. And so he really helped to write it up. And to me, it's one of the tragedies of Konzo that we've got people who can write it up, who can try and stop it, but we haven't stopped it. So it's a bit sad, or I feel sad, you know, that I'm coming to the end of my career and Konzo's still happening. Although we haven't had as much in Mozambique as we used to. Yeah.
I mean, it was very sad that Hans passed away so young. I mean, he was only 68. But if Hans couldn't get people excited about Konzo to do something about it, it's hard to know what you could do more. I mean, he's a very charismatic person.
It's shown to me how hard it is to work on diseases of the poor. It really is. You know, there's not the money, there's not the interest. And also there's maybe a bit of lack of communication between plant scientists and doctors. And that's why I've taken this up, Ros. It's a really good thing that you're able to do.
Yeah. Well, so I mean, this is the point of the working group, which I'll explain a bit in a minute. What I might do, I don't know if Kira's managed to find it, but we had the first paper that came out was in 1985 in The Lancet, so it'd be good if people wanted to follow that up. There were a couple of WHO bulletins that I don't have the link for, but we can put them in the show notes or something later. And then Hans wrote something for the CDC, the Centre for Disease Control, as well in the US.
No, that was a lot later.
Right.
That was taken up as a good example of an epidemic investigation when CDC was preparing material to study. Yeah.
Right. I mean, the reason that we met and the reason that we're here tonight and the reason that people on those who know the CCDN news mailing list are all here is because of Howard Bradbury, another wonderful person that passed away about probably 6 or 7 years ago now. And when did you meet Howard?
I met him in the mid-90s when there was a conference in Ibadan, Nigeria, because there was a cassava safety working group then, and they organized a conference which brought together all the people working in the area. It was a big breakthrough in many ways that was done, and that was where I met Howard. He'd come from Australia for this conference.
So I've got a picture of Howard here.
He wanted to do something. And
so what did you recommend
Howard he did.
So what did you recommend he do?
We can't measure what's happening. We need a good test because we didn't have a good test for cyanide. So I said this to Howard, and Howard's amazing. He went back to Canberra and invented the tests that people are still using many, many years later.
So I've got a picture of this. This is Howard in what was his lab at that time at the ANU with his little test kits, developing them up. And here's in the middle, I assume these are some of your colleagues because this is your picture, Julie, from Mozambique using the tests. So this is the thiocyanate test, but you can get similar test kits for cassava. What people don't know, maybe know if you're a user of these test kits. This is Jan Elliott, and Jan's on the line now. I can see tonight, and wherever you are, and she's the one that makes the kits now, and she does it actually as a volunteer. And the commercial companies are charged for the kits, and then that money is used to provide enough money to cover sending free kits for people who can't afford them. So there's those and but anybody can make them because Howard documented everything. Everything was published. in the mainstream peer-reviewed literature. He was very strict about doing that, and all the protocols are published on the website. And maybe, Kira, if you could put the Konzo website link in the chat so people can go and have a look at that. And so Jan's also got a repository of a whole lot of links to documents, and there's some videos and a whole lot of things there. So it's a good source of information. And now I'm going to wrap up soon. So there's just a couple of pictures. There's somebody where they've peeled the cassava. The peel's very high in cyanide, and the scent part of the tuberous root is not. So that's sun-dried. Then it's pounded up, and you make a flour, and then you make this sort of dough and then eat it. Now, the problem is, of course, that not all the cyanide is removed. So, Julie, do you know anything about how it's coming up with this wetting method and how effective it is?
Yes, I think it works. It's just that Howard spread the word, and people were really starting to use it more. And then we had COVID-19, and that stopped a lot of the research in the field. So it's a method that works. And I heard from somebody recently in Congo, and they were saying that their cases had gone down. They thought because people were using the wetting method. So it's hard to get information on this because it's hard to find out what's happening in these remote rural areas. But I think it's amazing that Howard developed this technique that's now used all over the world. We can just be very grateful for his science.
Yeah, fantastic. He did that work with Bania in Congo. Bania, unfortunately, also passed away recently, where they actually took the wetting method in, and they taught women in the village to do it, a few key people, and then they taught others. And everywhere that adopted, and this is published in the peer-reviewed literature as well, of his normal process to get everything really well documented. In the villages that adopted this, they didn't, in the time, it was only 18 months, but they didn't have any cases of Konzo. So it reduces the cyanide by about 97%, possibly even more. And the principle of this is that when you grind up the flour, what you're doing is you're bringing the enzyme that breaks down the cyanogen into contact with the cyanogen itself. And then when you add water, then that cyanide goes into the air. But the trick with this is to allow enough time. And it's very hard for people then to do it because, I mean, it's a nuisance if you've got to leave it for a few hours before you eat it. But if you can actually wait between adding the water and letting it soak and then spread it out to dry before you cook it and eat it, it will be safe. And of course, there are many other methods in other parts of the world. I mean, but this is a particularly effective method, which is certainly one of the ones that be very useful during harvest time, I think. This is a picture of Hans, which I assume you took, Julie, back in 2011. So Hans came for a bit of that was the 30 years after the initial studies.
Yeah, Hans came back to visit the areas. And this is him with somebody with Konzo who'd had it as a child in one of the settlements in Mozambique. So this was a return visit of Hans to where he'd worked all those years before. So it is a rather amazing beginning and ending, seeing him working on the first patient and then coming for a visit, 40 years later.
It's incredible. That's incredible. So I'm just trying to think, stop share. There we go. So that's a sort of list of my questions. I guess what I think I did have it highlighted on this slide is that there are I think other what do you see the future holding? Do you think there's dangers of other epidemics, or as you say, I mean, all these years later, it's very hard to get people to work on diseases of the poor.
Yes, I mean, I don't think we've seen a lot of progress in the investigation, although they've done a lot in the Congo. I hope they'll continue to work there. But it's hard to get people to work on something that is for the poor. It really is. And it's been very difficult to get big institutions, big organizations to put funding into this. So it's a struggle. And one thing we haven't mentioned, we've talked about Konzo, but in the Congo, when they've done studies, they've found that children in the same villages who've got high cyanide levels, they've got cognitive impairment. And looking at kids and seeing who's got cognitive impairment is something we have barely done, and we should. I think it's important. So it's very good to be together with you plant scientists who hopefully have some of the answers.
Yeah. Well, I hope so too, because I think it's just really important. It just, as I said, working on eucalypts and reading about this, it just seems so important that I did switch a whole section of my research to doing it for that reason. And of course, Howard is very inspiring. I think at this stage we might wrap up this formal part of the review, and I just, as interview, but I just want to ask you one question before I explain what it is. We have started this ad hoc international working group for Safe Cassava, which brings together plant scientists, microbiologists, neurologists, epidemiologists, dietitians, cassava breeders. It's a very diverse group. What do you hope that we can achieve through this group?
You're asking me?
Yeah, I'm asking you. I'm going to ask everybody, but I'm asking you first.
I'm hoping that there'll be more investment of agriculture in these poor rural areas, so people don't have to live on dried cassava. So I think we need more measurements, and we need to know whether kids are still getting poisoned or not. And we have to encourage more agricultural inputs in these poorest areas of Africa. Basically, more money, more people, but
yeah,
it's not something we want to continue with.
And I guess also some, encouragement of education. Do you think education is important as well? I mean, we've got the investment, of course, lifting people out of poverty is important. I mean, eating, because of the thiocyanate, you need sulfur in your diet. So, fish and so on is good. And that's obviously something you have to be rich. But, what about education about diet or education about processing? How important are those things?
I think they're very important, but we haven't been able to get this into curricula. And if you look at much of the material that's produced on agriculture, it doesn't mention cassava and cyanide. It just doesn't get in there. I guess there's a lot of other problems, but I really think it's a problem of poverty. The poorest don't get the same attention.
And it is completely preventable.
Yes, it's completely preventable if people eat other foods as well. So, and also we do have the wetting method, and we've got that to help. So I think it's a mix. You process cassava safely, but you also provide other foods.
Yeah, yeah. So,
and I
thank
don't
you
think I've seen any school textbooks with this topic in it. You know, it just doesn't make it. Sorry, Ros.
No, yeah, no, that's right. I was just going to say, I think what we'll do is we'll finish this now and go to the Q&A. And just while we're getting ready, if people want to post their questions into the Q&A, Isabel and Kira will be monitoring those. I guess Isabel will read them out. But I just want to just go on and just show you a couple of things just to explain what it is about this international working group. So back in 2011, we had a group of people from Mozambique and Zimbabwe, and my campus of my Monash University, my university at that time had a campus in South Africa. So we ran a workshop there. That was sort of like a beginning. I can see Umberto here and some others, so I can see her on the call. And then in 2018, Felix Zelda from the University of Zurich had developed a new type of test kit with this guy, ran a couple of workshops on cyanide and cassava, and we did that. And that was sort of starting to get there. We started to get a bit of a form. But then, of course, with COVID, nothing happened, and their research has gone in other directions. So last year, I got in touch with Julie and some others, and we started this Zoom group. So here's one of the meetings. I think this is the first meeting. And we've had a few presentations. This is, whose name escapes me, a PhD student from University of Greenwich. And so as I said, we've got various people from every continent. Actually, we don't have anyone from India. It would be good to have someone from India. And people who are doing different things with cassava. Now, what's the aim of the group? Well, of course, as Julie said, the aim of the group is to raise awareness and really try and get new avenues of research and new funding to do this. But I think one of the things we could do, because we started this group, and then the CCDN news, which was something that Howard Bradbury started, and Del Fernand and others in the Belgian continued to publish that, but Fernand has also passed away, and the focus of the Belgian group seems to have been more now on different areas. So that's why we emailed those of you who are in the Cassava and Cyanide Diseases Network to see if you wanted to be on the mailing list. So we had to have an opt-in and opt-out on that to make sure that we respect the privacy. And so that's a much bigger group. There's about 400. Is that right, Kira? It's about 400 on that list. You and Jan Elliott curated it. So, you can't have 400 people on a working group, even though we'd love to have everybody there. So what I think we'd like to do, and we have talked about this, is to have a symposium. And initially, Torkild from Tesla from Norway, he was Hans Rosling's first PhD student, I think. We had thought of going to Norway for the neurotoxicology conference, but that's not going to work. So we're looking for somewhere to hold a symposium, perhaps something along the cassava cyanide or the cyanide biology symposium that SIBA sponsored, 30, 40 years ago, something like that, where we can really get together and formalize and, really trying to work out what we're going to do and have a really concerted, a coordinated and concerted effort to try and solve these problems with cassava. So that's the introduction to the working group. That's sort of why we're here, and it's wonderful to be able to pay tribute to those who have gone before, like Hans Rosling, Fernand, Benir, and Howard, and those of us who are still working in the field, and particularly you, Julie, who was really there on the ground doing those early discoveries and making that connection by listening to the people and doing the tests and really doing very, very thorough work that was then published in the top journals. So I think if we can just thank you in the usual way and open this up to a Q&A. So I'll pass to Isabel, I think. Is that correct, Isabel? Will you handle that?
Yes, I will handle it. Thank you for all of you who have been participating both in the chat and in the Q&A. Especially thank you, of course, to those who have submitted your questions into this Q&A. I will jump directly to one of the questions I see. And don't forget to vote for your favorites. I will go for this one. There is a question by Ben Bennett about because he acknowledges that there is the existence of different varieties of cassava, one the street varieties and the bitter varieties, and the bitter one has higher cyanide content. When this early work that you have been talking about was done, were different varieties tested? Julie?
Yes, no, the different varieties were tested. And in these areas, we have both sweet and bitter cassava. What we found that during the drought, which caused the very bad epidemic, people had switched to bitter cassava because the sweet cassava had stopped growing so well. And that bitter cassava had high levels. We've tried to introduce more sweet cassava, but with limited risks, because for several reasons, people prefer to grow bitter cassava. It's more productive, the monkeys don't eat it, and so it's a satisfactory crop. And it would be okay if other crops were used as well, instead of it becoming almost a monotonous diet of bitter cassava. We should have used the words bitter cassava when we talked about this. Thank you.
Thank you. So next question by Nisha Bashist. She says, he says, I don't know. I'm sorry. Hello, Judy. It's been lovely getting to hear you talk. I was wondering if anyone has ever looked at rates of miscarriages in Konzo-prone regions. I imagine it's hard to track, but I have been curious about potential cyanide exposure in the womb. Do you know anything about this?
Yeah, we don't really have very good answers on that. But so what we've found is that when we've had epidemics, for example, we had one in Zambezia, the women who are pregnant, they get Konzo more because their basic diet is not so good. So there's been no systematic study on this, but we think it happens. So thanks, that's a very good question.
Yeah, I'll actually come in there just from a completely different point of view, but in areas of the United States where they had a lot of problems with the racehorses rolling around in the leaves and the insects from the prunus trees, which contain a different cyanogenic glucoside. And they found that they do have increased rates of spontaneous, abortion or miscarriage in the horses that that get exposed to cyanide. So it wouldn't be unexpected.
Mm-hmm. So next question by John Betangan. What role can research play in developing sustainable solutions for Konzo prevention and treatment?
I'm not going to answer that because I'm not an agriculturalist, and I hope that the agriculturalists will be able to answer it and say, how can we do it? Thank you.
Ros, do you want to jump on this question?
Yeah, well, there have been people who you can breed for more sweeter varieties that aren't as bitter. The trick is going to be to make sure that those sweeter varieties are also as high yielding and also as socially acceptable.
Thank you. So I see that many people are writing in the chat. Because I'm using the Q&A tool for screening the questions, I won't be able to look at your comments in the chat. So if there are questions there, please remember to post them also in the Q&A tool. Just a reminder. So next question by Janavi Varma. Hi, I wanted to ask, as breeders, what are interventions that have been introduced in plants to curb the inherent toxicity in cassava? Are there any?
Well, I'm the plant scientist, so I should come in there. Yes, you can. There are varieties that are sweeter and less bitter, and you can breed for that. There's also been a lot of work. Jess Lyons has been doing this in the United States, where she's made knockout GM cassava that has cassava has a slightly more complex way of making cyanogens. It has two different enzymes, and you can knock out one or you can knock out both. If you knock out both, you can get 0 cyanide cassava. If you knock out one, you can get it reduced, which is probably in the end going to be better. So they seem to work. She doesn't seem to see any growth sacrifice, but then they're growing in greenhouses. So I think maybe if you put them in a place where there's no rain, they may not go as well. I think we do have to look at these things. But personally, I think it's unlikely that you would get GM cassava rolled out across a place where people don't have enough money to do anything. But once you've got it, of course, you can grow it from a cutting, because I mean that's how it's all propagated, not by seed. So yeah, it could happen. It is happening.
So
yeah,
breeders,
that's all.
breeders are working on it.
Breeders are working on it. Yeah,
with different tools. Okay.
Mm.
So now there is a very interesting question by Sean Ayorinde. How can someone join the working group?
Yeah, well, we knew this was going to be a question, and at the moment it's just been people that we just happen to have met at conferences, and you know, and with representatives of different disciplines. So you know, we've sort of got, you know, one neurologist, one neurotoxicologist, one, you know, microbiologist. It's sort of, there's just sort of one of each of about 20 disciplines. I think we do need to look at having something more general. I think what we'll do in the interim is we'll run these webinars maybe every 2 months. I mean, we've got so many people and so many of you, I think, who are on this call, you know, all of you could probably have stories to tell that would be that everyone would benefit from hearing. So I think we'll start with the webinars, and then after we have the symposium, we'll try and formalize something about the working group. But if you'd like to join, please email me or email Kira. She can put her email in the chat, so you can respond to her, and we'll put you on the list. And I think we'll probably have to limit it about 50. But once you get above that, I don't think we can do anything. But yeah, please, just if you're interested, email Kira and we'll work out what we can do.
Okay, thank you. Maybe Ros, you and I, we can talk later on a way on how to help grow the working group and making it easier for anyone who is interested to really join in an online way without being necessary to meet in person.
Yeah, that's right. Yeah, no, so we don't, yeah, I mean, obviously any symposium we had would be hybrid.
Yeah, okay. So then there is a question that I've seen a couple of times by different people. How in different forms. So how you relate Konzo directly to cyanide's content in cassava? So it was just a correlation that you've seen that whoever ate it became sick, or have you seen what is the direct result of having cyanide consumed and what does it to your body?
Yeah, we don't have a lot of information on this because we've found that in the areas where Konzo happened, people who don't have Konzo have still often got high thiocyanate. And there's been one study in the Congo many years ago where they did show that a few people with Konzo had very high thiocyanate levels. But it's something that's not really proved. But what we do know is this disease has never happened anywhere where people haven't been eating a highly monotonous diet of cassava and where they haven't had where they've had low values of thiocyanate. But we haven't proved it as much as we'd like to, partly because it's unethical. You can't go into villages and start looking around for people who've got low thiocyanate. You have to do something. So that's made it quite hard to study.
Okay. That's a very good answer.
Not
so we have another question by Ben Bennett. Oh, it's more like a comment. So he comments that the cognitive development issues is very troubling. Very little is known about the role that some crops play in acquiring dangerous background chemicals from the soil. And he feels that this could be a big issue in the Great Lakes area. So that's another. Alberta Joseph Alexander asks, which regions of the world besides Africa is Konzo a problem? Do you know this? Or is there?
No, there's nowhere else where it's been a problem.
Has it been recorded elsewhere? I thought there'd been a few cases in Papua New Guinea.
No, they weren't. They were never proved as cases. But what's been shown in lots of places that outbreaks of cyanide poisoning from cassava occur, but they tend to be one-off. There's not that steady exposure that you get from a diet of several weeks. So so far it's an African disease.
I actually have a question that follows on from that, because in my reading, some people who have a high cyanide cassava diet also get things like goiter. Do you think, is that established?
Yeah, no, that's been shown. Yeah. No, that's a fact that has been shown, especially in the Congo. But we did those Hans did the study in Mozambique, and we didn't find it. Also, it depends, but often there's iodine around, and that'll help stop goiter. So it's only in certain places where there's a dietary combination that will cause it.
And is that because the sulfur's been used to excrete the cyanide?
No, it's because to get the goiter, you have to have certain biochemical factors happening. And when you're eating fish, you're getting a lot of iodine. So you're not getting that biochemical combination that you need for the goiter. There's a paper written by Hans back in the 1980s on this. And of course, there's all that early work that Belgian scientists did in the Congo many years ago.
So we have more questions. There is a question by Mike Bramber, and he follows a little bit about this lack of direct connection on the molecular mechanisms of Konzo and its direct relation with the consumption of of cassava and until now. And so I'm going to read it aloud. Do you think that the lack of understanding the molecular mechanism of Konzo is perhaps a reason why international attention is not as large regarding Konzo, particularly since cassava is a world staple crop and the vast majority of individuals, including impoverished individuals who consume cassava, do not get Konzo? Do we know enough to be sure that cassava is the actual case or just one factor? It's a bit controversial.
That's a good question, but I don't think the values are as high, and there are other foods being consumed as well. So, you know, it's a reasonable question, but it hasn't happened as far as we know.
Yeah, but there are different questions here. One is that there's I mean there is not this definitive answer that the cassava is the only reason or maybe a factor, but also that's the other question, that there is the lack of international attention is due to this lack of direct molecular mechanism.
I'm not sure, and I think maybe people working in developed countries can answer that more. But it's true, we haven't been able to get a lot of interest in this because there's not a lot of modern science attached to it. And there have been quite a lot of studies done where people have tried to find out what the toxin is. But apart from the cyanide, they didn't come up with anything. But if that's Matt Bramble who's asking the question, I think he also knows about the interest in the US and among neuroscientists. So could you reply as well if it is the person I think it is?
It is Matt. Yeah. So maybe he could add something to that. I was going to say, Matt, you're the one to answer the question.
Yeah, I'm going to let Matt speak if he wants to.
Hi guys, can you hear me?
Yes, we can hear you.
Didn't mean to raise too many issues. Yeah, I asked the question, Julie, because you some recent findings, of course, I presented on. I'm beginning, you know, the more I look into things, I'm beginning to wonder, you know, considering, I think the fourth largest staple crop in the world, plenty of impoverished people are eating cassava, but we don't see Konzo. Well, maybe, you know, it's unreported, but we're not seeing Konzo at the rates that I guess one could expect if it's a direct cassava to Konzo cause. You know, I think the intermediary factor, I certainly believe from your work and all the others that cassava is the trigger of disease. But what causes the disease, I think we don't know. And in conversation, I think maybe because we don't know that, and if we say it's cassava, you know, that's big business. That would be like saying corn in the USA causes something, but maybe corn is, you know, corn doesn't cause obesity, but if you eat enough corn, you know, and you're sedentary and a few other factors, yeah, you could become more obese due to caloric intake. But it's not necessarily the corn, rather corn plus A plus B plus C. You know, of course, like you show, a sulfur deficiency, a monotonous diet, you know, those are other factors. And I think maybe that's why we're not getting the kind of attention on the global stage, because it's a big statement that we all make, but we're missing the middle, the mechanism, essentially. I'm not sure if I answered or.
Yeah,
Do you have any more
thanks,
input?
Matt. Thanks, Matt. Yeah,
But it
thanks,
doesn't seem to be true. You know, but I think it would be great if you could show that there was more to it than we've shown so far. And hopefully that would also help with prevention. So it's very useful to have this research happening.
Okay, we can switch Matt off now.
Mhm.
Thank you, Matt. So next question, I'm screening for the ones with more votes. So here's one from Maruthi Gouda. Sweet varieties are grown more commonly now than before. Has it reduced Konzo? That's the question.
I don't have the figures on that, but it would be helpful. But I'd be grateful if the plant or agronomist people could answer that, because I haven't followed that enough.
Yeah, I don't have the answer to that either. I think that's quite interesting. It's not one of the other questions, because I can see them as well, by Poasa, who Nulavula, who I know from Fiji, so it must be very late there. So thank you for being up in the middle of the night. But I think your answer also comes into this, is that the sweeter varieties have lower cyanide, but when they're drought stressed, they can also become much more bitter. So that can be, so you might start with something that's sweet, but then if there's a really big drought, then it'll become more bitter. So it's not always quite so straightforward.
It's always complicated, many factors. So we have another question from, I think, related to the International Working Group for Safe Cassava, from John Betangan. What are the long-term goals of the working group, Ros?
I'd say in 2 words, eliminate Konzo. That would be the ultimate. And obviously to get there, you have to understand Konzo more, you have to understand cassava more, you have to promote education and take a multidisciplinary, multi-pronged approach. Ask another question if that didn't answer it.
I'm screening the questions. A question from Alberta Joseph Alexander. I am wondering if one focus is to see what other food included in the diet may alleviate the problems posed by using a predominant cassava diet. So we work with what other foods may be available and approach it from a diet perspective. It's more a comment than a question. So do you want, Julie, do you want to add something? I think you have mentioned a number of foods that could alleviate.
Yeah, I mean, what we saw in the first epidemic of Mozambique and in general is that the cases of Konzo didn't happen along the coast. And that's because people were eating fish. They had a much more protein-rich diet. But, you know, you can have things like beans in your diet. You can have more fruit, vegetables. And I would hope that would really stop Konzo. But the other thing we found in the last epidemic as well is that people were selling the cassava because it was giving them some money. So a crop that's so easy to grow and where people are suffering from hunger, it's actually quite difficult to get people to grow more things in a better way. And I think it's a long, hard struggle. I really do. And I'd love to see some good answers to it. Thank you.
Thank you. There is a question by Kokobe Wolde Johannes. Is there a report so far on Konzo problems with processed cassava products?
I think Ros can answer that. But no, we haven't, that I know of, we haven't seen that. But can answer on some of her data from Australia on the processed cassava there.
Yeah, so we did tested just products that were in Australian supermarkets, and Leon Brimmer has done the same in Denmark. And these are countries which are not familiar with eating cassava. So those of you who eat it all the time, this, you know, would find this surprising. But some of those products did have a lot of cyanide in them, and would no, they're not associated with Konzo, but they would cause intoxication. Some of them are up to 300 parts per million cyanide. That's a lot.
Okay, there is a question by Ben Bennett on if you know how prevalent is Konzo in Nigeria, a country where gari and other forms of processed cassava are common. And he assumes that the processing reduces the problem, but that's the question. How prevalent is Konzo in Nigeria?
Okay, well, there's no Konzo in Nigeria, but people aren't eating the cassava that's been processed in the way it's being processed in other parts of Africa.
Mm-hmm.
And so there's been no Konzo reported from there. What we do have is there's tropical neuropathies reported from certain areas of Nigeria, and that's been associated with cassava, but there's some arguments around that, whether it really is cassava, because it's quite a different disease. So I think that's an interesting fact about Nigeria. And just last week in ProMed, which is the infectious diseases website, they spoke of a whole family that died after eating a cassava meal, and they thought it was from the cassava. But I haven't seen any follow-up with proof from that study, because people sometimes think that when you're preparing the gari, if it's in workshops, then you can inhale some cyanide. So, but it doesn't happen that often, but it is reported.
Mm-hmm. Interesting. Mm. So there is a comment by Esperance Kashala Abons. In Congo, we found that people who have access to protein foods were less vulnerable to develop Konzo. Local people use proteins from insects, for example, due to poverty in getting animal-based proteins. So it's something that aligns what you mentioned before about the less presence of Konzo along the coast because of the fish.
Yeah.
I'm screening through the questions, but many have been already answered in a different way. So I'm skipping.
There's an interesting comment by Nardis Nkuduze, that there isn't, that it's not as simple to get the correlation between sweet and bitter cassavas and cyanide. I think the definition of sweet is that it has less cyanide, but I would absolutely agree that you cannot tell from testing the leaves. It doesn't tell you anything about the tubers.
Mm-hmm.
So you can have sweet leaves and bitter tubers and bitter leaves and sweet tubers. So I don't know if that's what you're getting at, but I think we do have to be a little bit careful, and it can change with the environment.
There is a comment by Dr. Ramesh Silaver, not a comment, I think it's a question. How we control the toxicity of cassava? If you are a farmer, how would you recommend? And maybe you can divide these questions. How can control a farmer? How the toxicity farmer first, or whatever person is preparing a food based on cassava? How can we control the toxicity? Just in easy steps from the field to the table.
I think that's a really difficult question, but people, when they plant the cassava, they know what's bitter, what's sweet, and they can share, like they can have rows of one and not rows the other. So people have an idea when they do the planting of whether it's bitter or sweet. And you see people doing clever things to try and cut down the eating of bitter cassava. So you might have bitter cassava in fields that are further from the house, because then when you collect them and bring them back and dry them, you can get lower levels. So I think people are quite clever at trying to minimize the amount of bitter cassava they actually have to eat. But then when hunger strikes, they can't follow all of those recommendations. But I'm not an expert on this. I don't ever want to pretend that I am, because I'm not. So, but there are plenty of people who've done studies on what peasants like to eat and why. And Hans Rosling, for example, and in the Chiwona, they did studies on bitter cassava in Malawi. So there's quite a lot of work on this, but it hasn't really, in my mind, come to good conclusions on preventing Konzo.
One of the experiments we did, just thinking about controlling the toxicity, is that it's been quite hard to replicate, as Kira will know because she tried to do this. But if you drought the plants and the toxicity goes up, then we found if we re-watered them for a couple of weeks, then the toxicity went down again. That's one experiment.
Mm-hmm.
We need to have field trials like that. We need things like that done on a really big scale, because that's true, because people might have, there may be some water that you could use for irrigation for a few days before you harvest it. You know, maybe that's the case, and maybe there's not. But if there was, that could be maybe a simple solution.
Is that experiment published?
Yes, it is published. Van de Geer, 2013, but
Oh.
I don't have it handy. I'm an author. So. So I think we could probably wrap up now. I know there's lots of questions, and there's many more things in the chat. It would be great to capture this. I think it would be fantastic to really, develop this further. I noticed Torquil's just made a comment. Perhaps we could read that one out. Just down the end, new one.
Yeah, Thorkild. In my view, the preventive efforts needs to focus on the processing of cassava, not of lowering the cyanogen content of the plant. People can grow very toxic cassava and still not have a problem. This is done in the Amazonas.
Yeah, I think that's true. If people got into the habit of processing, it's a nuisance, which is why people don't do it. But if you could get into the habit of doing it, it may make things simpler. Would you agree with that, Julie?
Yes, yeah.
Yeah.
Do we have time for another one?
Yeah, I think we have time for another one.
There's a different spin here from Thomas Jacob. Can we have a different look at the cyanides in cassava? Can we extract the cassava to be used as bioinsecticides in farming? This is a question for us.
Yeah, that has been looked at. I know with sorghum, which also has cyanogenic glucosides, they use it as a green manure, and the idea is that you chop it up and plough it in, and part of that effect that's beneficial is the cyanide in the leaves that maybe kill nematodes or something. So I think it can be done, but cyanide's pretty toxic stuff. You don't want to play around with it.
Mm-hmm. So should we wrap up?
Yeah, I think we'll wrap up now.
Okay. Thank you so much for everyone who was here during the webinar and has stayed until the very end of this long Q&A. Thank you very especially, obviously, to Dr. Julie Cliff and Professor Ros Gleadow for being here today, the real host and protagonist of this webinar, and presenting what Konzo is, what Konzo was at the very beginning, and how all the development from the 80s until now has happened. Thank you, obviously, to Kira Mahler for being here and helping and from behind the scenes. And as Ros has said, there will be more webinars on cassava, on Safe Cassava in the future. And you have just to keep an eye on this space because we will have you informed. Thank you so much from my side. And if any one of the speakers want to say something or just say goodbye.
Just goodbye from me. Julie, do you want to add anything?
No, just to say thanks and goodbye. Yeah.
That's good. No, it's great. Great to see so many people online. Yeah. Fabulous. Yeah. Really encouraging.
Yeah.
Mm.
Bye-bye, everyone.
Bye. Cheers.
Bye. Thanks.
So people are leaving the room now. I will stop the recording.
Bye.
Bye. There's some really great, really lovely comments in the chat. It's great.
Yes. Yes, I will. We will have the recording soon. I think I'm going to need to combine the recording from YouTube and the recording from Zoom because I wasn't able to record the very first part in Zoom. And that means that it will take a little longer in order to make this available online. If Julie agrees, and that is the thing. Do you agree to make this talk recording online?
Yeah, that's fine.
Okay, perfect.
Mm.
Well, thank you so much. And I will close the room now.
Thank you.
Okay, thanks, Julie.
Bye. Have a great day.
Bye. Good night.
Bye.
Good night.
Bye. Bye.
Sleep well.